I am so excited to be back here with you. I am Pamela D Wilson, caregiving expert, advocate, and speaker, and your host and your instructor for this program. We are going to talk about participating in consistent medical care. This builds on the prior segments about talking about hospitals and how to navigate the healthcare system. Let's keep going. Let's get us through the housekeeping. As you know, I substitute elderly parent or elderly parents for whoever you are caring for. Doesn't matter. The outline for this module is in the course materials for the programs. Print the module outline, print the slide handouts, take notes. I encourage you to take notes. Come back and look at the notes. The ellipses in the slides are purposeful because I want you to follow along with me. So let's talk about the objectives of participating in consistent medical care. At the end of the importance of participating in consistent medical care, you should be able to recognize how regular medical care and diagnostic testing can identify early stage health problems. You should be able to apply the idea of being the squeaky wheel to get proper care and relate the benefits of establishing positive relationships with medical providers. Very, very important. The key to managing health. So regular medical appointments and checkups are the keys to managing and maintaining health at any age. It doesn't matter if you're 18, 35, 55, 75. Regular medical appointments, checkups. Regular checkups and blood work can identify early disease stages or health problems before they become significant, before they become a problem. But if you don't go to the doctor, this will not happen. It's also essential to be that person, that patient who asks questions, whether you are tending individually or with an elderly parent. Becoming an educated and engaged patient ensures better than average medical care. Establishing a regular relationship with a regular medical provider who knows you, who knows your elderly parent, and your medical history is important. There's this huge trend now that you may have noticed toward all these walk-in emergency medical clinics because it's viewed to be easy. I don't need a regular doctor. I don't have to call and make an appointment. But the downside is you're not establishing a relationship with a regular doctor who knows you. And if that medical clinic says, well, follow up with your regular doctor, who do you have to follow up with if you haven't established care with a regular doctor? You're not going to get the care that you need in the long term. It may be great in an emergency situation, but it's not a permanent solution. So this is where I talk about being the squeaky wheel. And this really results to advocacy. Advocacy is what I call being the squeaky wheel. And it's necessary if you want better than average care for yourself or a loved one. We all want better care, but it takes effort to get it. So many caregivers tell me that they feel like they're bothering a doctor if they ask questions. I get it. You feel like all of these doctors and medical professionals are rushed. But to help yourself, you have to be that squeaky wheel to get the care and get the attention that you and your elderly parent deserves. Otherwise, you're going to fall into that group of caregivers who said, oh, I wish I would have been more persistent. I should have asked more questions, but I didn't. And you're going to be saying that after something horrible happens to an elderly parent. So here's an interesting thing. As you increase your involvement in the medical system for an elderly parent, you're going to realize that the healthcare system is imperfect and that there are flaws. But that's okay. These providers and these systems, they're honestly strained to find qualified and caring staff. And sometimes the constraints of these insurance plans and the internal systems are also a challenge, which is why you have to be that squeaky wheel to keep asking, to keep going, to be persistent, to get to the end game, to get to the result that you want. Because the increase in the number of elderly, it's going to continue to strain the healthcare system. That is going to continue to have struggles to find willing and able bodies. But providers will talk about this with you. It's not something that's hidden. It's just something that you don't know about until you become involved. they're going to admit that hiring, training, retaining staff, it's an issue, and it's going to continue to be an issue. So unless you choose to speak up, you will get poor medical care. The population is aging. Between 2000 and 2020, the fastest growing segment in the United States was people over age 65. By 2030, the number of people in the world 60 and older is going to increase by 56%. And by 2050, it's going to double to over 1.5 billion. So as you can see, the numbers are going to continue to grow. The number of people who need care will continue to grow. If you don't speak up, you're not going to get the care that you need. Managing your relationship with healthcare providers is important. Many of us don't feel like we have to establish a relationship. But if we don't, again, it goes back to, do you want poor care or do you want better than average care? Sometimes elderly parents can be in denial about care needs, or they can refuse care. Refusing care and treatment today can have a long-term and negative effect on a parent who changes their mind and decides that they want medical attention in the future. You might be surprised to know this, but information about every appointment with a doctor is placed in every medical chart. Every time there is a refusal to accept advice, a refusal to take medications, or follow through with treatment recommendations, this information is documented in the chart of your elderly parents. It's documented in your chart. The information in a medical chart follows patients, follows you, your elderly parent, from doctor to doctor to doctor. This information, these refusals, they can affect treatment options in the future. Patients who refuse medical care are called non-compliant, which is a medical speak term. They can be called a problem patient. Being recognized as non-compliant, who doesn't agree with care recommendations, who doesn't follow through, doesn't help your chances or the chances of your elderly parent to get the care and treatment that you want for yourself. Because if I was a doctor and I had a patient who did everything I recommended and who was flourishing and they needed treatment, I would advocate for that treatment if an insurance company was trying to decline it. On the other hand, how far do you think I'm going to go to argue with an insurance company for a patient that doesn't follow my recommendations, or a patient who is unlikely to recover from this treatment because they don't take care of themselves? It's the difference between night and day. Compliant means that, or non-compliant, I should say, means that you or an elderly parent refused medical care. You were less likely to agree to care recommendations. You were the caregiver who came with a parent who didn't support care for your elderly parents. You don't want to be that problem patient. It's going to affect your future. If you refuse care, again, you want to explain why, so that the why can be placed in a medical chart. So for example, if I don't want to go get a colonoscopy now and my doctor recommends it, why don't I want to do that? Do I have other medical priorities, like I want to get my knee surgery done first? Or I'm having issues with my thyroid, and that to me is more important right now than a colonoscopy. If so, say that to your doctor, but say, after I get my knee surgery, after I get my thyroid situation figured out, I'm happy to go get the colonoscopy, but I can't do everything at once. I want to prioritize these to the degree that I think they're affecting my health. That helps a lot. That makes a big difference in getting client care. Because over the years, I can tell you, I had so many clients that I got who were problem patients, who were non-compliant patients, who had medical conditions, who didn't listen to the doctors, who did things that were not wise. So for example, I had a client who was an alcoholic, who swore that he wasn't drinking. And one day he ends up in the middle of winter on the sidewalk in front of his apartment with a huge gash on his head. He goes to the hospital. His blood alcohol level is sky high, and yet he promised he wasn't drinking. Beer cans were all over his apartment. The hospital had to induce a stage of treatment to do detoxification because the alcohol level in his body was so high. As a result, going back home, not an option. Just like not an option for my other client who didn't want to take care of herself. He had to go to a community where there were other people who were alcoholics, who were there in an assisted living community, recovering from treatment. But I, as his care manager, as the guardian, had to guarantee this community that I would continue to be involved because they didn't want him continually leaving the community, going to seek beer or alcohol, bringing that back into the community, sharing it with other residents, having it affect other residents. Parents, people in our families, they can be non-compliant. They can be problem patients. It's up to us to be the squeaky wheel, to be that advocate that says, yes, I promise to be involved so that I can get care for my parent to make it a better situation. Many times it can work out. There are some times where it just doesn't work out. So Benny's story. Benny is another favorite client of mine who I actually met in the hospital emergency room. He had a friend who lived in California who tried to help him over the years, and the friend actually called me about a month earlier trying to get me to go to Benny's house to visit Benny so that I could become engaged in Benny's day-to-day medical care. Benny refused, said, no, I don't want that woman coming over here, absolutely not. So what happens, Benny has another health episode, ends up in the hospital emergency room. The hospital emergency room threatens to call Adult Protective Services because he's not being wise about his medical care. Hospital emergency room calls a friend in California who calls me. I agree to go to the emergency room. I spend 5 hours with Benny explaining to him the consequences of why he really doesn't want APS involved, why cooperating to receive medical care and to go to regular medical appointments would be much better for Benny to get what Benny really wanted, which was to stay at home. Benny didn't want to go to a care community. He wanted to stay there in his house, get the care that he needed. And fortunately, in his situation, he had the financial ability to do that. 5 hours later, I had the hospital convinced that I would be involved in Benny's care on an ongoing basis. I had the hospital convinced that I would find a way to get Benny home, which involved a large number of steps and a lot of coordination, and that Benny wouldn't be back in the hospital unless it was for treatment like putting in a new pacemaker or something he actually needed. I was able to work the situation out for Benny, but it was because of my expertise in being a care manager, in knowing how to work with healthcare providers, in knowing how to establish those relationships so that they trusted me to take care of Benny so that Benny would not be a repeat offender in the hospital emergency room, so that Benny would not be that non-compliant patient, so that Benny would not be a problem patient. Benny actually was another one of my favorite clients. I took care of him until he actually passed away a few years later. It was a pleasure. It was an honor. And the reason that I have the flags in this slide is because he was a veteran. He was in the Air Force. And he actually, after that, was a teacher in the public school systems who taught history and political science. Amazing, highly intelligent person, just didn't have family available to take care of him. And so he became a problem for the healthcare system. Okay, so the importance of establishing and maintaining positive relationships. Elderly parents and caregivers can learn a great deal by working together with healthcare providers, but only if you ask questions and become engaged about how do I make this situation better. And my soapbox statement that you will hear is no adversarial relationships. No matter how frustrated you become with anyone, find a positive way to work together through the frustrating issue or the relationships, because you You never know when you may need help from this individual in the future or how they can help you. You have to focus on the part that says, we may disagree here, but one thing that we do agree on is that we both want care for this person. So with that in mind, how do we accomplish that? If one medical office isn't a good fit, find another provider. Never stay with a provider with whom you feel the relationship is not positive or helpful, but also realize that you could be the problem. You can't keep running from one provider to the next, because that does indicate that the problem is you, your behaviors, and not the provider. The severe shortage of caring and qualified workers in the healthcare system can impact customer service. Be patient. Learn to rise above the frustrations of receiving inadequate care, sometimes inaccurate information, sometimes poor follow-through, and poor customer service. These are skills that we can learn. We can learn social skills to get along with other people, to be patient, to be empathetic about their situation, but to stress the fact that we need good care for our elderly parents. Most of all, maintain your composure. At times, the frustration can be overwhelming. Sometimes there's no right answers. Sometimes you feel like you're getting the runaround. Nobody's willing to be accountable. Realize that all systems have constraints and are limited by people, time, processes, rules, and guidelines. Concerns are better received when the messenger, that is you in this case, is emotionally composed, factual, and polite. Nobody wants to be at the end of screaming, yelling, or extreme expressions of anger or frustration, especially in a public healthcare office or on the other end of a telephone. Know that the healthcare system is in the process of initiating patient engagement and patient experience programs. This means that the system is working to address customer service issues, streamline appointments, processes. They're using online medical portals. They're establishing virtual appointments. They're creating bill pay systems. They're making progress, but this progress is not going to happen overnight. Just like it takes us 60 days to establish a new habit, it can take the healthcare system multiple days, weeks, and months to improve these processes. Just don't give up. Remember that it's important to attend regular medical appointments. They can identify issues before they become greater. Be the squeaky wheel. Be that advocate. Speak up, ask questions, ask how to improve situations, and most of all, create positive, ongoing relationships with medical providers to get the care that you need and want. Use available technologies if you can. All of these actions can greatly improve the medical care that you receive for elderly parents. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. Thank you again for joining me for this webinar. It has been my pleasure. I'll see you soon in another webinar. Keep up the good work. Keep watching these webinars. Keep documenting. Keep reading your notes. The progress that you are making is amazing, and it will benefit the care of your elderly parents. I'll see you again soon.